I'm Richard Ntakirutimana, and I have been serving as Executive Director of African Initiative for Humanitarian Progress Organization since 2012. IMPO was founded in 2001 by Batwa community indigenous people. Our organization actually is a local organization within Rwanda, and over 20 years we have reached several key milestones in our mission to improve and uplift the lives of indigenous people in Rwanda. Some of our significant achievements include supporting 1,074 households in the district of Nyagatare, Gicumbi, Bugesera, Musanze, and Burera. We have also made a progress in raising awareness about the challenges faced by Batwa, advocating for their rights and providing them with opportunities for sustainable development. Our economic empowerment initiative, such as small-scale enterprise training and agriculture projects, have helped families to generate income and become more self-sufficient. In the realm of education, our advocacy efforts and sensitization campaign have led to increased school enrollment among Abatwa children. We have seen this in improving literacy rates and educational opportunities for them. Long ago until now, there is also human rights advocacy, which has helped raising awareness about the rights of Batwa and how to contribute to greater inclusion and acceptance within Rwandan society. I always tell people that I want to see a Mutwa graduating from Harvard University. I want to see a Mutwa doing business, contributing to sustainable development goals, contributing to the development of a country. I want to see Mutwa employing people, giving jobs to other people. Those are my wishes. How to reach them? It means that we need hand from different people. I want to see Batwa kids staying together, living together, studying together with other kids from different families. That is where people dream what they see. People dream what they see. That's why we want people to make our dream reality. The Rwandan government categorizing Batwa as historically marginalized people, which is a positive step towards promoting inclusivity and unity in our society. However, this name of HMP, historically marginalized people, it doesn't fully address the challenges that Batwa still face. Of course, we understand it prevents future conflicts and fosters a sense of Rwandan identity, but it does not automatically translate into improved living conditions or equal access to resources. So one of the main challenges is that Batwa now still lack recognition and understanding from the broader society. Because when you call people historically marginalized people, you have to explain there is a history which happened to them. So as a government, to make clear to society, you have to define that history and putting a guidance of how you are going to address that history that has been uh, negative to them. In this case, there is a unique needs and vulnerabilities often overlooked, which affect their ability to secure support and funding. Because of what were not recognized, anyone who even willing to come to help them, it lacks some data. Another issue also is a limited accurate data and information about Batwa's living conditions. This hinders the policy making and planning, making it difficult to allocate resources effectively because it is prohibited. It is illegal to conduct any census that is based on ethnicity or identity. We indigenous organization conducted, we found that we are 36,000. This number has been used since 1994 up to now. 36,000, 36,000. We don't know whether we are declining or we are increasing. We don't know whether there is a growth of population of the Batwa or there is a decline of the Batwa population. But to my point of view, this number of 36,000 is a big number. Compare, I think we are declining instead of growing. To our understanding, the marginalization started when we no longer access to our traditional homeland, which was the forest. Because when we are in the forest, we used to live in a good life. We are having opportunities to access food, to access medicine, even to access financial means. But after eviction, that's the marginalization started. Because we came out from the forest and we started to live with people who don't want us and just who treat us as a subhuman being. We are not represented like other Rwandans in decision-making organ. We have challenged access to food, to education, and health. That is exactly the evidence that we have been left behind. And for the government, instead of understanding our issues, they always insist that we are all Rwandans. Of course, we are all Rwandans, but we are benefiting differently. We benefit differently. In Byumba and other areas where we work, access to proper sanitation facilities and clean water is limited. This leads to usage of unsafe drinking water, thus the cause of immediate consequences like the spread of diseases, including waterborne illnesses such as diarrhea, dysentery, and high risk of malnutrition due to poor sanitation, and waste disposal practices that are directly linked to undernutrition in children. So, as for long-term consequences, it includes a cycle of poor health, as well as limited economic opportunities and social inclusion. Lack of proper hygiene and sanitation facilities also impact children's education. When our children looks poor, looks unclean, they can't go to school because no uniform, no shoes. Majority of them they suffer ginger, jigger. So those things, because of poor hygiene, limits our children to go to school. And access to medicine is also a problem for the Batwa. It means because of poor hygiene, which leads to high end in treatment, you have no capacity to go to hospital, you don't have health insurance, the result you die. The sanitation and the hygiene education community center, we see it as a critical component of our project. Its primary goals are twofold. The first is infrastructure, and we aim this infrastructure to provide the Batwa with access to clean and safe sanitation facilities, including toilets and clean water resources. This infrastructure, of course, it is essential for improving their overall health and well-being. The second component is about education. We have seen that education is key for development. This includes teaching water purification techniques, waste management, teaching community about the proper hygiene practices. So addressing both infrastructure and education is crucial, of course, because it will create a holistic approach to tackling hygiene and sanitation challenges. Like providing facilities alone is not enough. People have to understand using them correctly to achieve lasting improvement in health and living conditions. I cannot generalize, and say that all non-indigenous projects, non-indigenous lead projects lack cultural sensitivity. There is a risk that they want to fully understand the culture nurses and specific needs of the Batwa community. Because cultural sensitivity is important in addressing the Batwa challenges as their way of life, traditions, and values are distinct. A lot of organizations currently who have been working with our community, it seems they're given up, you know, because of lack of understanding their culture and their needs. To me, I can't give up. I can't start criticizing my community that they are not changing. No, changing is a long process. I am from eastern province of Rwanda. But if I reach northern province, reaching Batwa community, I can communicate them easily, even if other Rwandans cannot even understand what we are talking. That is the uniqueness of culture. When I reach in Gicumbi, I see them as my grandfathers, as brothers and sisters. I feel like sad because seeing them suffering giga while other neighbors are okay, I feel sad. So when non-indigenous people are there, for him or her, it seems that these people are complicated. These people are, you know, they are, you know, they behave, you know, badly, something like that, like undermining them. Sometimes the non-indigenous Seed project, they lack a holistic approach of understanding the community needs and the community norms. I cannot end this without appreciating organization like Azim Foundation and the other partners who have been on our side since 2001. Without those organizations, without friends, I couldn't even, you know, be here and talk to you. Because it's not easy to see like people like a Zima Foundation sitting in the United States of America and thinking about, you know, about the Batwa condition. This is really, really something Ubuntu, what we call Ubuntu. Helping without any return, helping just from the bottom of your heart. Like you taking your time, discussing about how we can improve the Batwa condition. It's really something I appreciate. I have never met you. I have never met with even other organizations that have been supporting us, but their grant has been contributed a lot in terms of improving the condition of our beneficiaries. Otherwise, without friends, without donors, we couldn't even now say that one day there was a Batwa in Rwanda. So, but because of that support, that of kindness, we still arrive. We thank you very much.